concept. So I'm going to finish with this concept is how I started to look at why is fat permanent? How does it permanent and what happens over time? And I do a lot of hair restoration, as you heard, and that is a model that I've used. So as I was setting for the hair restoration board, I was looking at Walter Unger's book, and I was looking at this and seeing, oh, this is how a hair graft works. Neovascularization for a hair graft begins at about 6 months. Before that, you get what's called primary and secondary inoculation processes that are tenuous blood supplies that formalizes over a period of 6 months to a year. So what we see, unlike hair transplant, is initially edema. And with that swelling and edema, there's distortion and we think we have a result. But the fat cells may shrink a little bit, the blood supply may not be enough in that early phase where it's doing too much, and then a patient sometimes at about 3 to 6 months goes through a dip phase. I call it a dip phase, and they all come back going, oh, I'm going through my dip, and I photograph them, I watch them. And I see that the result actually continues to improve over 2 years. So the temptation is at 2 to 3 months, oh, I didn't do a good enough job, let's stick more fat in. I think your penalty is going to be paid at 2 to 3 years out, which is going to be an overfilled face that's very difficult to correct. So we need to have patience and understand the pathophysiology or the physiology of how something occurs over time. So let's use some clinical examples. This is a 48-year-old. On the left, the patient already had a facelift and wasn't really achieving the degree of rejuvenation she wanted. This is a week after a fat transfer, and she's bruised, she's swollen and distorted, but through that swelling you can see what that honeymoon swelling where she looks younger. At a month, I think she looks a little bit overinflated in the cheeks, but she looks softer and more youthful. And that's another point I want to bring up, is that, you know, if you make a cheek just blown up without blending the buccal zone, you just have a large, big, ugly cheek. Everything needs to be blended, and that's why, for me, full facial fat transfer is truly a higher art than just putting fat in a certain area. And then about 3 months out, perhaps you're looking at this face and going, hey, that's pretty good. You know, I'll probably be happy with that. And I would be too, but there are going to be other changes. For her, she dipped later. If you look at the 6-month point, you know, there's a little bit of dip. And you know what's really interesting in the world of hair is sometimes I see dips at 12 months. I see sometimes dips at 6 months. Sometimes I see dips at 9 months. Grafts are a very interesting species. There are different changes over time. But if you look at her uniformly over time at 11 months, there's something better with her. There is not a touch-up. I didn't do anything else. And this is an ongoing improvement of fat over a period of 15 months. And I think you get, just like in a world of hair transplant, you get about a big bang at 6 to 12 months, and you get a little bit of improvement from about 12 to 24 months, with being smaller from 18 to 24 even. This is a lady at 1 week, 40-year-old, that you look at her and she looks a little overinflated, swollen, distorted. And then she didn't come in at a month, which I usually like to take my photo, but she came in at 3 months. And I was like, wow, this is a significant compromise in a result. But actually, you know what, let's just wait, let's not do anything. And at a year, I think things have picked up. And I think this photograph also shows 2 other things, which is that the importance of the buccal area of how to blend that face to ovalize it. And the second thing is it shows the 5% rule, which is the idea that her brow and her lower eyelids are not that remarkable. She's so happy with it. In fact, she did a video testimony about how great her lower eyelids look. And if I looked at this as not that great, but you know, it doesn't matter, because look at her face. The face looks so much better, and that's how we interact. We don't interact with pieces, we interact with larger units, which are the face. This is 1 month out. This is 3 months out, and she doesn't dip much. So not everyone necessarily dips. I would say probably 30 or 40%. But whether they dip or not, there are going to be changes over a period of time that are going to be better and worse at certain intervals. And then 2 years out, no skin therapies, nothing else, and even Botox her, something's gotten better over that time. This is a gentleman at a week, bruised, swollen, not perfect. At a month, to me this looks pretty good. I don't overfill my gentlemen. I tend to be very, very conservative with men. I think they look way overfilled in most cases. There's a different aesthetic paradigm. This is 3 months with a dip occurring, and you can start to see that dip recovery, where if you look at it, it gets better over time. And the point is, at a year or two, if you look at it in a compartmentalized fashion, I've not succeeded in one area. I've succeeded in small ways in multiple areas. So think of big picture stuff. If I can train you to think and see today, I think that's going to be very important. Final photograph, 1 week out, 1 month out, and you got to be careful that 1 month because all the wrinkles are stretched out. So oh, I love that time. Well, that is sort of a fabrication. You got to let that patient know. And she's from out of town, so I didn't see her at closer intervals. This is 9 months out. And 2 years out. So there's this ongoing changes to the face that you've got to be cognizant of. So this is the book here. Thank you for your attention. And Mark is going to start with the live demo. This is my email if you need to contact me. And I would also like to promote this course in July, as Mark is setting up, July 23rd through 25th here at SLU. We had amazing courses last year. We went sold out, just fantastic, and we've actually quadrupled the size for next year in terms of our program. So as they're setting up, I just tell you it's going to be an amazing experience. It's here at SLU. So I welcome all of you to come next year, July 23rd to 25th. And I'd like to thank Karen over there for amazing work. So, all right.